We will talk about the hip. So the hip bone, it is a large irregular flat bone which is located in the pelvis, and it is formed by the fusion of the three primary bones. They are named as ilium, ischium and pubis. Now within the hip bone we found two special characteristics. One is a cup shaped halo that is known as the acetabulum, and a big triangular foramen that is known as obturator foramen. So the ilium, ischium and pubis, they fuse and form the hip bone, and its another name is innominate bone, and it has a acetabulum for articulation with the head of the femur and form the hip joint, and it has a triangular foramen named as the obturator foramen. And the part anteromedial to the foramen is known as pubis, and the part posterior inferior to the obturator foramen is known as the ischium. Let's see how does it look like. So this is a figure of the hip bone. So this part is the ilium, this part is the ischium, and this part is the pubis, and all these three parts are fused together along the cup shaped cavity that is known as the acetabular cavity or acetabulum, and there is a triangular foramen in the hip bone that is known as the obturator foramen. Now let's learn about the ilium. The upward expanded fan shaped part of the hip bone is known as the ilium. It has two ends, three border and three surfaces. It has upper end and lower end, anterior, posterior and medial borders, and three surfaces: iliac fossa or ilial surface, gluteal surface and sacropelvic surface. Now let's learn about the upper end. The upper end, it is represented by a thickened border. Above there is a thickened border which is known as the Eyelia Crest. So upper end, it is also known as the Eyelia Crest. And the highest point of the Eyelia Crest lies at the level of interval between the lumbar 3 and lumbar 4 vertebra. Now, where does it extend? It extends from the anterior superior iliac spine in front up to the posterior inferior iliac spine. Sorry, anterior superior iliac spine up to the posterior superior iliac spine. The anterior superior iliac spine, it provides attachment to the lateral end of the inguinal ligament. Above and below there will be sartorius muscle, and posterior superior iliac spine, it provides attachment to the sacrotuberous ligament. The iliac crest is divided. We can divide the iliac crest into a large ventral segment. The anterior 2/3 is known as the large ventral segment, and posterior 1/3 is known as the smaller dorsal segment. And this ventral segment, again, it has an outer lip, an intermediate area and an inner lip. The outer lip, at first come to the outer lip. Let's see what are the attachment of the outer lip. It presents a tubercle which is known as the tubercle of the iliac crest, and it is situated 5 cm behind the anterior superior iliac spine. There we will find the tubercle of the iliac crest, and we will find there a fascia that is known as tensor fascia lata, which is a deep fascia of the thigh, and we will find a muscle that is known as external oblique abdominis muscle. External oblique abdominis muscle will be in the anterior 2/3, and behind there will be latissimus dorsi muscle, and the intermediate area, it provides attachment to the internal oblique muscle. So I for eye, intermediate area, there will be internal oblique abdominis muscle. And now come to the inner lip. Inner lip, in its anterior 2/3, there is attachment of the transversus abdominis muscle, and in the posterior 1/3 there will be attachment of the quadratus lumborum muscle. And now come to the dorsal segment. That means posterior 1/3 of the iliac crest or upper border is known as the dorsal segment. It is divided by a ridge into inner sloping surface and outer sloping surface, or you can say the lateral surface or medial surface. The outer sloping surface gives origin to the gluteus maximus muscle, which is a muscle of the buttock, and inner sloping surface gives origin to the erector spinae muscle. So this is all about the upper border. Let's see how does it look like. So this is the picture of the hip bone. This is the outer view and this is the inner view. You can see this is the anterior superior iliac spine. We told you the upper border extends from the anterior superior iliac spine up to the posterior superior iliac spine, and this is the upper border or iliac crest. Okay, and we divide the iliac crest into anterior 2/3 or ventral segment. So this is the ventral segment. So anterior 2/3 or ventral segment and posterior 1/3 or dorsal segment. And in the outer lip, we told you that there is a tubercle of the iliac crest, which is situated about 5 cm behind the from the anterior superior iliac spine. So, and the muscle attachment is shown here. You can see the muscle attachment is shown here. This is a very good picture of the attachment of the iliac crest. You can see in the outer lip there is the tensor fascia lata, external oblique abdominis muscle and latissimus dorsi, and in the intermediate area there is the internal oblique muscle, and in the inner lip you can see there is the transversus abdominis muscle in the anterior 2/3 and quadratus lumborum in posterior 1/3 of the ventral segment. And in the dorsal segment you can see by a vertical ridge it is divided into two area. Outer surface, sloping surface, it provides attachment to the gluteus maximus, and inner sloping surface, it provides attachment to the erector spinae muscle. Now come to the lower end. The lower end of the ilium, it forms the upper 2/5 of the acetabulum. So which one is the lower end? You can see this is the lower end. Sorry. This is the lower end. This is the lower end of the ilium, and you can see there is the acetabulum. So it forms the upper 2/5 of the lower border. It forms the upper 2/5 of the acetabulum. Now come to the anterior border. Anterior border, it extends from the anterior superior iliac spine up to the acetabulum, and here it forms a notch which is known as the ilial notch, and the anterior, just below the notch there is another spine that is known as the anterior inferior iliac spine, which provides attachment to the straight head of the rectus femoris in its upper part and iliofemoral ligament in its lower part. Now let's see which one is the anterior border. So this is the anterior border. Look at that, it extends from the anterior superior iliac spine up to the acetabulum, and it presents a notch. It presents a notch also, and a projection that is known as the anterior inferior iliac spine. So this is anterior superior iliac spine, and this is anterior inferior iliac spine. So this is the anterior border. Now let's learn about the posterior border. The posterior border, it extends from the posterior superior iliac spine up to the upper end of the posterior border of the ischium, and it presents from above downward the posterior inferior iliac spine and greater sciatic notch. Up to the upper part of the greater sciatic notch, we can say this is the posterior border. Let's see which one is the posterior border. So the posterior border, it extends from the posterior superior iliac spine up to the upper border of the greater sciatic notch. You can see there is a notch. This is the known as greater sciatic notch. So up to the upper border of the greater sciatic notch, up to this is the posterior border. So this is the posterior border of the ilium, and you can see just above the greater sciatic notch there is another bony projection that is known as the posterior inferior iliac spine. So there is in the posterior border there is a posterior superior iliac spine, posterior inferior iliac spine, a notch that is known as the greater sciatic notch. So up to the upper part of the greater sciatic notch, this is the posterior border. Now come to the medial border. The medial border, it extends downward, forward and medially from the Eyelia Crest up to the iliopubic eminence, and it separates the iliac fossa from the Sacro-pelvic surface, and lower one third of the medial border, it forms a rounded arcuate line. Let's see how does it look like. So this is the medial border. It starts from the Eyelia Crest and it ends at the iliopubic eminence. This is the iliopubic eminence. This is the medial border. In this medial border, it separates the iliac fossa. It separates the iliac fossa from the sacropelvic surface. Okay. Now come to the surfaces of the ilium. We told you that the ilium has three surfaces. At first, the iliac fossa. The iliac fossa, it provides attachment to the iliacus muscles in its upper two-third. So just in front of the medial border, this is the iliac fossa or ilial surface, and it's in its upper two-third there is attachment of the iliacus muscle. So you can see in the upper two-third of the ilial surface there is attachment of the iliacus muscle. Now come to the next surface, that is the gluteal surface. The gluteal surface is divided into four areas by three gluteal lines. These lines are the posterior, inferior and anterior gluteal lines. All these lines radiate from the upper margin of the greater sciatic notch. So just behind the posterior gluteal line there will be attachment of the gluteus maximus muscle. Between the anterior and posterior gluteal line there will be gluteus medius attachment, and between the anterior and inferior gluteal line there will be gluteus minimus muscle, and the reflected head of the rectus femoris is situated between the inferior gluteal line and upper margin of the acetabulum. Let's see. So the outer surface is known as the gluteal surface, and you can see this is the gluteal surface. There are three lines: inferior line, anterior line and posterior gluteal line. So by three line the area is divided into 1, 2, 3, 4 surfaces. So at first there will be attachment of the gluteus maximus just behind the inferior line. These three lines divide the gluteal surface into four surfaces. So just behind the posterior gluteal line there will be attachment of the gluteus maximus, and between the anterior and posterior gluteal line there will be attachment of the gluteus medius muscle, and between the anterior gluteal line and the inferior gluteal line there will be attachment of the gluteus minimus muscle, and just below the just below the inferior gluteal line and the upper margin of the acetabulum, there will be attachment of the reflected head of the rectus femoris muscle. Now come to the our last surface, that is the sacropelvic surface. The sacropelvic surface, it is situated just behind the medial border on the inner side of the ilium, and it has two parts, sacral part dorsally and pelvic part ventrally. Now come to the sacral part. The sacral part presents a tuberosity, which is known as tuberosity of the ilium behind, and an auricular surface in front. The iliac tuberosity is a rough area and it provides attachment to the three ligaments from behind forward. These are the iliolumbar, dorsal sacroiliac, and interosseous sacroiliac ligament. And the auricular surface, it articulates with the corresponding surface of the sacrum to form a sacroiliac joint. And the pelvic part of the sacropelvic surface, it is smooth and continuous with the pelvic part of the ischium to form the lateral wall of the lesser pelvis. And this pelvic part of the sacropelvic surface, it provides attachment to the obturator internus muscle. You can see just behind the medial border, this surface is the sacroiliac surface, and it has two parts, pelvic part and sacral part. So this is the pelvic part, this is the sacral part. Sacral part again has two components, one is the iliac tuberosity and another one is the auricular surface. This is the auricular surface and this is the iliac tuberosity. And we told you that iliac tuberosity, in the iliac tuberosity there is attachment of the three ligament, and in the auricular surface, this auricular surface attached with the sacrum and form the sacroiliac joint, and the rest of the smooth part, it is known as the auricular surface. This is known as the pelvic surface, pelvic part. It is smooth, and here there is attachment of the obturator internus muscle. You can see in the iliac tuberosity there is attachment of the three ligaments, and the auricular surface, here the sacrum is attached and form the sacroiliac joint, and the rest of the part, that is smooth part, is known as the pelvic part, and here is the attachment of the obturator internus muscle. So that's all about the ilium.